Hello, my name is Nancy Lead, and I decided to create an audio story to explore the lives of people affected by neuroendocrine cancer. Neuroendocrine cancer is a cancer that targets the endocrine system, which is responsible for producing the hormones that regulate the body. Cancer research is a multi-million-dollar industry intended to create treatments for a disease that's impacted millions. People with various degrees and skills bring forth ideas that have cured myriads of patients over the years. To get a better sense of this dynamic, I visited the Dana-Farber Cancer Research Institute to get personal accounts of the employees who research neuroendocrine carcinoma and have dedicated their lives to this cause. The doctor and researchers you'll hear are telling their stories themselves. For confidentiality purposes, I have not been able to record actual patient voices. However, the patient stories you'll hear are the words of the patients themselves recorded by voice actors. The audio story represents real testimonies of the patients and their families suffering from neuroendocrine carcinoma. Can you please introduce yourselves?
I'm Matt Kolke. I work at Dana-Farber Cancer Institute. I'm an associate professor here, and I direct our program for carcinoid and neuroendocrine tumors.
My name is Lauren Bray. I'm a clinical research manager for the biobanking group. So what we do is we collect blood and tissue samples on patients who have neuroendocrine tumors, and we use those samples to do various research projects.
My name is Trevor Dutton. I am a clinical research coordinator for GI oncology at Dana-Farber, and I work specifically with Dr. Kolke and his team on neuroendocrine tumors.
What is one word to describe your collective experience treating patients or working on the research?
It's been really exciting, I would say.
I think it's frustrating, but in a good way.
What drew you to neuroendocrine cancer research?
So other than the fact that I kind of took over the person's role as neuroendocrine clinical research coordinator, I'm really glad that I actually got into this role because the patients are really interesting. Because obviously, with patients with these types of tumors, their endocrine system is thrown off, so all their hormones are kind of off balance, and they are more interesting cases than I guess other patients that we see here. So. That definitely has that wild card factor where you never really know what you're going to expect. So that is, I guess, one instance is that they are interesting people and they have interesting medical histories. And research in this field is pretty limited. So Dana-Farber definitely has a good program here, but it is a rare disorder, neuroendocrine cancer that is, and being part of the research is pretty cool because it is so limited.
As Trevor mentioned, neuroendocrine cancer is extremely rare and the treatments typically vary. I have with me a patient suffering from this disease to share the story of his journey.
Hello. I was diagnosed 6 months ago with an undifferentiated high-grade neuroendocrine carcinoma of unknown origin, in the lungs, liver, and on my ribs. I'm a 41-year-old male. I've been through 2 rounds of chemo, cisplatin, and CPT-11. The first round was about 50% effective. I found out this week that the tumors have become resistant to the chemo during the second round. The tumors have started growing again. The doctor has ordered to change a new chemo called Taxol and etoposide. I'm starting in 1 week. I'm looking for any information from survivors of this type of cancer or alternative treatments. Someone out there, please reply. Thank you in advance for any and all replies.
The patient you have just heard is not the only person suffering from this type of cancer. You will now hear the wife of a patient who expresses her frustration about the lack of answers she has.
My 33-year-old husband was diagnosed with NEC in the stomach with Mets to liver. As per biopsy, Ki-69 index of the stomach is less than 10%, while the index for the liver is up to 40%. This is high grade. He cannot have a surgery because it's too invasive. The oncologist said it's not curable, and the goal of the treatment is just to control the disease and prolong life. We took a second option from Dana-Farber, and they agreed with our oncologist's treatment plan. He is currently on chemotherapy, which he is tolerating well. He was hospitalized for jaundice, and the scans revealed tumors. stents were placed, and the acute pancreatitis was so severe that he had to be in the hospital for 3 weeks. He lost 20 pounds and is now 127 pounds and is slowly getting back to his normal routine. He was in the best health before the diagnosis. Do we have anyone cured of this disease? Why is Ki-67 different in his stomach and liver? Has anyone had it in the stomach and just chemo to take care of it? Anyone to answer my questions or make me feel better? It's so hard to get this diagnosis and harder with a newborn to take care of.
Many of these patients and their families have similar questions. I have asked people at the Dana-Farber Cancer Institute about their responses to these common questions, and this is what they have to say.
What kinds of signs should patients look for with this type of cancer?
So with the neuroendocrine cancers that we treat, these cancers particularly can be really hard to diagnose because there's so many different signs. They can arise anywhere in the body. So some people will have pain, and that's something that happens in other cancers. But the neuroendocrine cancers can also secrete hormones, so you can get some really bizarre hormone-type symptoms from this as well. So there's really not a single sign or symptom with this kind of cancer.
How do you approach the families of the patients?
Something that happens is that the families want to talk to us separately because they're afraid about the news that the patient is going to get, and they try to protect the patient. But what we usually try to do is just put everybody in the same room together and just answer people's questions so that everybody hears the same thing. I think it's often kind of a relief because then it removes the sort of wall between the patient and the family.
Obviously, treating and diagnosing patients is an extensive process, but can you briefly summarize your treatment plan in a few sentences?
One of the things about treating cancer is that there's not always a single right way to do it. It's not really a cookbook formula, and that's because we don't fully understand all the treatments, and also because every patient is different. So that I think the best way to describe it is that when we come up with a recommendation or approach, it's kind of a mix of looking at scientific data, like what are the statistics, and then talking to the patient to see what is kind of the good fit for that particular patient.
We have heard about the struggles of the patients and the patient families, and the researchers have kindly answered some common questions that they may have had. Now let's hear about the individual experiences of these researchers.
Do you ever struggle with balancing the research aims of patients?
Not really. It can be tricky because there are standard treatments and then the research treatments. And the research treatments are unproven. And we're really careful to try to explain that to our patients so that they have a real understanding. The thing, at least in this situation, is that there just aren't a lot of standard treatments, so sometimes the patients are really interested to get access to some of the new things that might not be widely available because it takes years for new drugs to get approved and become commercially available.
I don't have as much direct patient contact as I did in the past, but I used to work as a clinical research coordinator, so I spent time speaking with patients in the clinic. Oftentimes these patients were just newly diagnosed, and the patients were, obviously emotional and upset. And so sometimes you would, get some interesting reactions from patients. And so I definitely had some experiences where I had to, console patients, and it's definitely challenging not to become too emotional and too attached to patients because they all have such interesting stories. But we always have to keep in mind the overall goal of researching and using these patient samples to do the best research that we can. So I think it's, balancing between having empathy for the patients, but also remembering our overall goal of research.
Specifically with neuroendocrine patients, I guess, like a lot of my job is going through their medical records and seeing all those, like all their treatment histories, including like their types of chemotherapy, radiation, surgeries, and that has really, kind of opened up, like the world of medicine to me, essentially, like seeing like what goes on in clinic and how patients are treated. So basically, before I came to Dana-Farber, I thought I wanted to be in a research lab, not seeing patients, just working on, lab stuff like that. And I also thought about business school at one point too, but, coming to Dana-Farber and seeing patients and, working with them and working on their databases, I've come to realize that I want to, be in medical practice, and I'm actually applying to PA schools this summer, so I guess that's kind of how it has affected me.
I think in general, working in cancer research and at a cancer institute definitely makes you appreciate your family members and realize how quickly people's lives can change with a diagnosis of cancer. But I think that it's exciting to work at a place like Dana-Farber that is on the cutting edge of research, because it gives you the opportunity to sort of make an impact and make a change, and hopefully what we're working on will help people in the future, so that cancer doesn't affect them as much as the current patients that we have.
The best part, I would say, is, like I was saying, like the very interesting medical histories. So you come across a lot of, maybe weird primary tumor sites for the patient who has a neuroendocrine tumor, because they really can, develop in many areas throughout the body, and and then like I said, that has some pretty strange effects on patient's personality and things like that. So I think that is kind of the coolest, maybe best part about working with specifically neuroendocrine type cancers. But then the worst is, I think just in general, this is the same with any type of cancer. Is like, you will go through a patient record, and they might be like 22 years old and have like your age or something, and have like a metastatic cancer. So it's kind of tough to read through patient records like that.
The best and the worst is that there's still not a lot known about it, which is bad because we wish we understood more, but it's good because there's so many things we can still do.
Although neuroendocrine cancer is extremely rare, thankfully we have brilliant people who dedicate their lives to finding a cure to such a terrible disease. However, we don't have to be researchers to help. A simple donation can help contribute to the bigger goal. I hope this audio story has given you a better understanding of neuroendocrine carcinoma and the efforts being made to cure it. Thanks for listening.